that if we talk of 1947, life expectancy in this country was 32 years. We are today at 70 for males and 72 for females. And actually in the middle class and the upper middle class, our parents and grandparents being 85, 90 is very commonplace. So was that the right way? We were just growing. India had been ravaged for 200 years and we were learning. But yet, there was none of that rancor, none of that lack of faith, none of that lack of trust, none of that feeling that we have today, where it seems that it's become more a transaction. Has it been good for doctors? Definitely, it hasn't been good for patients. What happened? Why did this happen? Actually, the government brought in an act, the Consumer Protection Act, which did not include doctors in it, did not exclude them also. And it was in the early 90s that in a case which was heard in the Supreme Court, that they said no, the patient is a consumer. And having said that, it unleashed probably so many different energies which probably the Honorable Supreme Court in its wisdom may not have realized at that point of time. It may have been only thinking of protecting the patient, but in the process, the entire practice of medicine in this country underwent a change. We always talk of the doctor-patient relationship. It's a sacred relationship. It's a very important relationship. It's something that most of us doctors value. But suddenly, after this, the patient became a consumer, a customer, and the doctor became a seller of services. Maybe that is what it was all the time, but it hadn't been legally defined as that. And also, the medical professional hadn't been put in the dock, so to say. So, how did things transform? A patient who felt aggrieved, rightly or wrongly, could just write a postcard. At that time it used to be, I think, 20 paise. Send a complaint to the consumer redressal forum, consumer court, and on behalf of the patient, the case would be fought. And it became, in a way, the government against the doctor. I'm simplifying things. I'm sure there are many more intricacies in it, but just to make a point. So suddenly, the doctor-patient relationship transformed. And this is not the only forum where a patient could go. I believe there are 11 other forums, courts, where a patient can simultaneously file a case. And a doctor will have to defend himself in all those various fora. Being in 2 or 3 or 4 is not unusual. What did this lead to? Of course, it transformed the doctor's thinking. He became very defensive. He became very cautious. And therein came the ills of the West, or the Western healthcare system, which is defensive medicine. Previously, and even today, people say, "पहले तो नब्ज देख के दवाई देते थे, ठीक हो जाते थे." अब तो इतने बाद में होती है, पहले टेस्ट कराते हैं. Is that right or is that wrong? Today, in this era of evidence-based medicine, are you willing to take medicine for a perceived ailment without tests? I think even the patient, the citizen at large has transformed. We are in an era of evidence-based medicine and we want evidence before therapy is given. And so it was on both sides. The patient getting transformed and wanting evidence, rightly so. Why should I take medicine, steroids, antibiotics, and so on and so forth? Still happens. All given together, whereas only maybe just some antipyretics may be needful. So on the patient side, it was right, and also on the doctor's side. Now imagine a scenario, and we face this on a daily basis, where a patient comes with headache, which is not improving, 2 weeks, goli khate theek ho jata hai, and then still comes back. And a doctor just treats symptomatically, does not ask for, say, a CT scan or a MRI. Now we do know that about 2% of these will turn out to have some physical ailment, some maybe even a tumor, maybe something else, arteriovenous malformation. And think of that doctor who didn't get it done, but a second one, 3 months down the line, did it, and it turns out to be a great tumor. What would be the response? The doctors in the doc. I mean, most of us became doctors. Generally, we were in the upper half of our class as far as academics went, and also because we wanted to treat, heal. Most of us didn't look at any other profession. And the moment you get this notice, actually a doctor's world more or less collapses. And so I can tell you from the doctor's point of view, it has been detrimental. One, on a personal level. Two, maybe even on an institutional level. Now you have a legal department in every hospital. And three, from the defensive medicine point of view, which ultimately leads to higher cost for healthcare for the patient. And from the patient point of view, that lack of trust, lack of faith, that breaking of the relationship, it's not good for the patient. I personally, if you ask me, I feel the patient has lost out. Now, the other thing, they say, commercial ho gaya healthcare. That's a very common refrain. Everyone says, oh, corporatization, commercialization. Today, healthcare is dependent on technology. We just heard of all the factors you have to keep in mind. We are looking at digitization. We are looking at artificial intelligence, equipments which cost a lot. I mean, it's said that we should manufacture in the country. I'm part of many government companies where we encourage this. We, babysit these projects. But are we able to make good enough quality? And as was said, are doctors even able to wanting to adopt it if it's not at a certain level? So that's where everything is imported, everything is very, very expensive. Also, if we look at private health, which is the vilified, healthcare, the land is sold at commercial rates. The building is built on commercial rates. Power is on commercial rates. Water, everything is on commercial rates. And then it is said, why are costs increasing? No longer is there any subsidy for private healthcare on anything. And then the comparison is made with the government sector, where the taxpayer is paying for everything. If you go to a government hospital and a surgery costs 5,000 rupees, it's not as if it is costing the hospital 5,000 rupees, but that's the impression that a patient gets कि गवर्नमेंट हॉस्पिटल में 5,000 लेते हैं, प्राइवेट हॉस्पिटल में 50,000 लेते हैं, ये लूट मची। Whereas it may be that the costs in a government hospital may be higher than the price being charged in a private hospital. So this is also something that has to be set right. And I would say that where a cost in a government hospital is 500 rupees, they should put in brackets, this is what it has cost us to deliver this to you, which may be 40,000, 50, it may even be 60,000. And there was a study done in the All India Institute for prostate surgery done about 10 years ago, where it turned out, and this was part of the hospital management team which did it as part of the thesis, that the cost that they were incurring on prostate surgery was higher than the price being charged in a corporate hospital of Delhi. So it's what the common janta doesn't know, and that creates further trust deficit. The other thing which has led to this trust deficit is this feeling that money can buy health. If that was possible, that I've come to this great hospital, I'm spending 5 lakh rupees, मेरा पेशेंट ठीक क्यों नहीं हो रहा? How come after the struggle in the ICU and the patient died? You know, this is the other thing which is very common, and you hear it कि ऐसे नहीं है, ठीक कैसे नहीं हुआ? If that was the case, no king or queen would ever die. You know, the rich would never die, and that's another thing. Maybe we have been, as doctors, remiss in telling society that we are not gods, and we accept that we are not gods, even though we are said to be demigods, which we don't want to be today. And with a minute and 38 seconds left, I'll say that a recent judgment of the Supreme Court has tried to rectify or probably modify the previous judgment, where in a recent judgment where the lawyers were in the Supreme Court saying that why should the Consumer Protection Act be used against lawyers, where the Supreme Court said what is the difference between lawyers and doctors? Doctors are in the Consumer Court, why should you not be? There the lawyers argued that the doctors, if the doctors have been wrongly put in the Consumer Protection Act, how can that be used for putting us? And the Supreme Court, the Honorable Supreme Court in its judgment has said that doctors and their societies should approach the Supreme Court for rectification of this judgment, and that process is on. Let's see what happens on that. And finally, we have a new, Nyaya Sahita, the criminal procedure code in this country, which says that in case a patient becomes vegetative during treatment, the doctor can be sentenced to 10 years or more of jail. Now this is self-defeating, because when a patient comes in the emergency and you start reviving, we don't know when he gets revived whether he will be normal or whether blood supply to the brain has affected to such a level that he will be vegetative. And this law says that if he is in vegetative state, you are to blame. So this is another thing. Somehow, maybe we as doctors, as medical professionals, haven't been able to fight our case very, very well. But this is so self-defeating that doctors will stop trying to revive. How can, in an emergency, when someone comes, how can you just not try to revive if you had the opportunity to do it and the patient may actually revive and be normal. So there are, facets to this whole debate. There are pluses and minuses, but I think this whole definition of the patient as a consumer needs a relook so that both the doctor as well as the patient can work in harmony for the betterment of the sick and ailing in this country. Thank you very much.